Ambassador Dr John Nkengasong, whom GASA Media has been covering his work-related activities while in Africa, Addis Ababa in Ethiopia as the Director for Africa Center for Disease Control and Prevention from 2017 to 2022. His most recent position, still in public health, as the Ambassador for U.S. Global Health Coordinator and Special Representative for Health Diplomacy and United States President's Emergency Plan for AIDS Relief, has ignited many discussions about this man, especially among Lebialem community. Dr. John Nkengasong, whom is from Lebialem, has over 30 years of working experience in public health and a solid background in virology. Has offered many interviews about HIV/AIDS, tuberculosis, and recent COVID-19 pandemic to many renowned media like CNN, BBC, Talking Africa. Our GASA Media correspondent had the privilege to meet with him face to face. The first question to Dr. John Nkengasong was to know why the vaccination rate of COVID-19 in Africa is still low compared to the rest of the world.
Was it because the logistic, the supply is not there, or the supply is there? The people back in the continent are not willing to take the vaccine. And why is it that the vaccination rate is too low?
Thank you so much for the opportunity to speak with you on your program. The vaccination rate on the continent of Africa is less than 25%, the average vaccination rate for COVID-19. And in the developed world is in excess of 80%. So there's a huge inequality and huge disparity and inequity in access to vaccines. And we are in a very different place with the pandemic, that is the COVID-19 pandemic. 1 year ago, it was an issue of access and availability of vaccines because the continent of Africa produces only 1% of the vaccines that they need. So in other words, they import 99% of vaccines. And we know that vaccines are an important game changer when you have to fight infectious diseases. Today, because the world has ramped up vaccine production, and because of the science, the revolution that occurred in the science of vaccine development, there's plenty of vaccines available today. The challenge now have now shifted to the uptake of the vaccines in Africa. So we have to continue to work with the community leaders. Let them be the leaders that guide us as to how and where vaccination will take place. There's a saying that vaccines without vaccinations doesn't lead to vaccination. So we have to prepare the population, continue to encourage them, and sensitize them that the vaccines are safe and the vaccines are efficacious.
Yes, thank you for that wonderful question answer, because there's always this theory or this conspiracy theory that vaccine will cause autism. It will kill little children, so people should not take vaccine. So your message to, especially to the Lebialem people watching you right now, is that when the vaccine are there, they should go for it.
Absolutely. Vaccines is the only game changer in the history of infectious disease when it comes to controlling the virus. And I will make a case that most, if not all, people of the Lebialem origin, the only reason they are alive today is because they have been vaccinated in the course of their childhood with what we call the expanded programs on immunization, the measles, the cholera vaccines, the tetanus vaccines. So I think all those vaccines have helped to bring us to where we are. They have helped to increase life expectancy. So the vaccines that we currently have for COVID-19 are not different from those vaccines that we have all received in our childhood.
Just last month, on October 16th, Dr. John Nkengasong received a prestigious recognition virtual health award with a monetary value of 500,000 euros, and where he asked the foundation to send the money to Africa to help bridge the inequality among vulnerable population as part of his global health initiative. GASA Media wanted to know if he is considering Lebialem people due to the poor infrastructure, including poor roads and hospitals.
So my question to you is, will Lebialem people benefit from this? Or are you considering Lebialem people to also benefit from this one?
No, absolutely. First of all, I must say I'm still very honored and grateful and maybe very humbled that I was chosen out of many global health leaders to receive the first Virtual Prize Award, which is in the field of global health, the equivalent of the Nobel for medicine. And it came to me as a surprise, and it was a big occasion. It's just on the 15th of October that the who is who in global health was in Berlin to celebrate that award. I'm truly grateful for that. As you rightly said, it came with a prize of 500,000 euro, which I could have received it for my personal use. But I think in life it is not necessarily what you have that matters, it is what you do with what you have that matters. So I decided that I will make available that entire proceeds from the prize to supporting vulnerable populations across Africa in my own little way to bridge the gap in health inequities. I have been doing that all my life, so I think in Lebialem this will not be new, but Lebialem will always benefit from any proceeds that I have. And in Lebialem we should be thinking of doing greater things to rehabilitate the health infrastructure that has been destroyed because of the crisis. I fully recognize that 500,000 euro is not enough, but once we have a strategic direction and a strategic plan to rehabilitate our health infrastructure in Lebialem, I'm committed to mobilizing the resources as much as possible to support that. Health is wealth, and the only thing that we all enjoy mostly on earth is good health. If I enjoy good health, I like the community in Africa and community in Lebialem to also enjoy good health.
Yeah, thank you so much, Doctor, for that. Wonderful. I'm glad to hear that at least the Lebialem people will somehow benefit from this.
Lastly, we asked Dr. John Nkengasong about the prospect of HIV vaccines.
I know at some point in your career you were a board member for the HIV vaccine initiative in New York and in Norway, I believe. So what is the prospect of vaccine for HIV? I know there are therapies, there have been treatment where people can now live longer. Mother tested HIV positive can now give birth to children thanks to the therapy. So, but what about the vaccine, which will be a preventive measure?
No, first of all, I think it is important to say that because of the generosity of the American people, through the initiative called the U.S. President's Initiative for AIDS Relief, commonly called PEPFAR, which is the program that I lead now under the Biden administration. About 21 million lives have been saved on the continent of Africa. That program has contributed 100 billion over the last 19 years in the fight against HIV/AIDS in Africa. We will continue to be extremely grateful for that program, for the impact it has created. If you recall, 20 years ago, life expectancy has decreased significantly in Africa, especially in Southern Africa. Because of that program, countries have gained more than 12 years because HIV/AIDS has been reduced and pushed to the back end. The fight is still there. HIV/AIDS is not done, I believe strongly, as a public health expert, as a virologist, that the only way we are going to eliminate HIV/AIDS and eradicate it is if we have a vaccine, an effective vaccine. We currently do not have any, despite the millions that have been poured into HIV research. The virus is a very canny virus. It's a formidable enemy. It has enjoyed research from all angles of life. In my 30 years experience in infectious disease, I don't know of a single disease that has been researched like HIV, but yet we don't have a vaccine. I remain hopeful that with the revolution in the vaccine technology, the mRNA technology, which is the messenger RNA, that a vaccine against HIV could be developed. If we have effective treatment and effective vaccines, that is a recipe for us to eliminate HIV in future. I was a board member of IAVI, the International AIDS Vaccine Initiative, and CEPI, the Coalition for Epidemic Preparedness. I had to step down from those functions because of my current appointment. But we remain hopeful that science is changing. Science is taking us to a place that we were not expecting. I would never have imagined that within 1 year, a vaccine against COVID will be produced, will go through clinical trials, and will be used in vaccinating the population. Without that revolution in technology and science, the outcome of this pandemic, which has killed more than 6.5 million people, would have been devastating.
Yeah, Dr. Nkengasong, thank you so much. It was my pleasure asking you these few questions. I hope you enjoy your evening.
It was a wonderful experience for GASA Media to talk to this man from the White House, a man whom you often see in suit at international conference was in his simple African outfit. This is GASA Media for Community News. I am Immaculate Naloa. Thank you.